Subscribe the channel and press bell icon so you won't miss any updates. As an allopathic medical practitioner, you will be responsible for restoring and maintaining the health of your patients using allopathic medicine and treatment practices. What do graduates in allopathic medicine do? After doing an MBBS course or after further specialization, an allopathic doctor may provide diagnosis and treatment of patients in hospitals or clinics. He or she may also perform research work for developing new medicines or treatment methods. An allopathic doctor's work will differ depending on the specialization they have, but in general, on a typical day as a doctor, you may be seeing patients in the OP department of a hospital or a clinic, running tests as well as interpreting them, making diagnoses and prescribing medicine or treatments, doing rounds to visit inpatients in the hospital, making notes on patients' physical conditions and giving instructions to nursing staff, taking to patients and bystanders on patient care and further treatment, performing surgeries if you are a surgeon, attending seminars, classes and reading books and medical journals to keeping updated, carrying out administrative duties such as updating patient records, returning phone calls or dealing with various office issues, dealing with medical emergencies that may arise within the hospital or at times even outside beyond working hours. Anesthesiology is the branch of medicine dedicated to pain relief for patients before, during and after surgery. ENT physicians are trained in the medical and surgical management and treatment of patients with diseases and disorders of ear, nose, throat and related structures of head and neck. General medicine is the branch of medicine that deals with the diagnosis and non-surgical treatment of diseases of the internal organs. Neurology is the specialty dealing with disease pertaining to nerves and the nervous system. Neurologists treat strokes, Alzheimer's disease, seizures disorders, and spinal cord disorders. Gynecologist treats women during pregnancy and childbirth and for diseases of the female reproductive system and genital tract. Ophthalmology is the branch of medicine and surgery that deals with the diagnosis and treatment of eye disorders. Orthopedics is a medical specialty that focuses on the diagnosis, correction, prevention and treatment of the patients with skeletal deformities, disorders of the bones, joints, muscles, ligaments, tendons that make up the musculoskeletal system. The branch of medicine dealing with the children and their diseases. Psychiatry is the medical specialty to develop the diagnosis, prevention and treatment of mental disorders. Physical medicine and rehabilitation, also known as physiatry, is a branch of medicine that aims to enhance and restore functional ability and quality of life to those with physical impairments or disabilities. Physicians specializing in diagnosing radiology are trained to diagnose illness in patients through the use of X-rays, radioactive substances, ultrasounds or magnetic resonance images (MRIs). Surgery is a branch of medical science that treats disease or injury by operative procedures. How to become an MBBS doctor? Take science stream with biology, chemistry and physics. Studying biology, chemistry and physics at the +2 level and securing a minimum score in these subjects would be a prerequisite for admission into medical courses. Take MBBS. MBBS is the foundation course in allopathic medicine. The candidate must have completed a higher secondary school with physics, chemistry and biology or biotechnology and English as their subjects and must have cleared the NEET exam. The duration of the course is 5.5 years, which includes 4.4 years academic education plus 1 year's mandatory internship. Take a postgraduate degree in specialization of choice. MD and MS are the second level postgraduate degrees in the broad specialties of medicine and surgery respectively. The duration of the course is 3 years. Diplomat of National Board. After completing MBBS, you can also go for DNB programs. Diplomat of National Board is the title awarded by the National Board of Examination to candidates who successfully completed their postgraduate medical education under it. People who have completed in MD or MS are also eligible for appearing in the final DNB certification exam along with regular DNB trainees. Take super specialty courses. After completing post-graduation degree, you can go for super specialty courses like Doctorate of Medicine. The duration of the course will be 3 years. PhD in medicine. After completing post-graduation, you can also go for doctoral level studies if you are interested in medical research. If your profile is excellent, you might get entry for a PhD in renowned foreign universities as well. Requirements for admission into a PG course in one of the top institutes to help you get an overall picture. In India, NEET, National Eligibility cum Entrance Examination, rank below 200 approximately. Candidates must possess a valid MBBS degree from an institution recognized by the Medical Council of India and have an MBBS degree or provisional certificate to that effect. Completion of the rotatory internship, provisional or permanent medical registration certificate issued by the MCI or the State Medical Council. In foreign, MBBS or its international equivalent and a qualification that can be registered with the General Medicine Council IELTS academic, total 6.5, at least 6 in each module. TOEFL IBT, total 92, at least 20 in each module. Other relevant documents like letters of recommendation and academic transcripts. Communication skill. Doctors need to communicate effectively in order to ensure effective treatment and continuity of care for patients. Compassion. Patients who are sick or injured may be in extreme pain or distress. Physicians and surgeons must treat patients and their families with compassion and understanding. Patients. Physicians and surgeons may work for long periods with patients who need special attention. Persons with fear medical treatment may require more patience. Detail-oriented. Patients must receive appropriate treatment and medications. Physicians and surgeons must accurately monitor and record various pieces of information related to patients' care. Problem-solving skills. Physicians and surgeons need to evaluate patients' symptoms and administer for the appropriate treatments. Dexterity. Physicians and surgeons may work with very precise and sometimes sharp tools, and mistakes can have serious consequences. Humility. With your patients and colleagues, you must be approachable and available. Professional ethics. Doctors have an ethical duty to protect the human rights and human dignity of the patient. Other career options a medicine graduate can enter. Social services, also called welfare service or social work. Any of numerous publicly or privately provided services intended to aid disadvantaged, distressed persons or groups. Medical practitioners can contribute more to the society and people in many ways, as they are the people who can diagnose, treat and prevent the illness or disease. Education and training roles are usually essential positions needed in society and offer a stable work life. Medical practitioners who possess the necessary skills, have the required qualification and have the passion to change and influence other people's life can take up to this profession. Medical practitioners can work as professors in government and private colleges. Government services, civil services and defense. This is one of the most sought out careers in India. Medical practitioners can work in government clinics or dispensaries, and they also have opportunities in armed forces.